social cluster. As you will know, 2 ministers of that cluster did speak to the media. The Minister of Basic Education and the Minister of Higher Education did speak to the media. They might join us later, but the ministers that will be speaking to us now in the social cluster is the minister responsible for social development and also the minister responsible for water and sanitation. So these are the ministers that are before us now. Without any further ado, I will get any volunteer from them to come and speak here. Anyone who wants to volunteer between the two. Who wants to volunteer? Okay. Minister Zulu will speak to us on the measures that they will take to indeed implement what the President has said. Thank you, Minister Zulu.
Thank you very much, Chairperson, Comrade Jackson. We are the Department of Social Development, and under our department we've got agencies, both SASSA and the National Development Agency. We are working as a portfolio. We are making sure that first and foremost we have a coordinated approach to the work that we are doing, so that both the human and financial resources are properly coordinated. That's the first thing. The second thing is that we are working with the MECs of all the provinces, and at this point I really would like to thank the MECs for working very easily with us despite the challenges that they are facing, because, by the way, each province has got its own dynamics. And I do want to say that I'm talking to all the MECs, all of them. And we are coordinating very well with them to make sure that they have the necessary powers and functions that are necessary for them to implement the guidelines as have already been declared, not only what the President spoke to yesterday, but also we are ensuring that at a national level, all the MECs and all the other structures at local level, they need to adhere to the guidelines as indicated. And therefore, I appreciate the cooperation that we are getting. I also would like to say that I'm appreciating the NPOs and civil society organizations, including the churches, who are also stepping up and working with us in a coordinated manner. We have not concluded all the systems of how we're going to work very close with them, considering, of course, the fact that the lockdown was only announced yesterday, and immediately after the lockdown was announced, we have been working to find what are our systems that have to respond and respond adequately to the situation. We also would like to thank the private sector, who have also stepped up to say, from their work environment and the finances and the power that they have, how can we work together with them? May I also mention that here, it's not just the private sector. In our space, we have people that have been feeding the nation in different ways, through our early childhood development programs, through all our structures which we have as social services under the Department of Social Development, as well as SASSA and NDA. And we are thankful that they've all stepped up. And again, I'm saying it's work in progress, because we need to really make sure that we give them all the necessary support. What I would like to point out, particularly to those organizations that have called us to say they want to be of assistance to us, Some of them have raised concerns about where they are going to be able to be feeding some of the children who are now at home, who have been depending particularly on the ECD centers and all other centers where we are. They've raised very serious concerns about the safety of their trucks, about the passages of those trucks when they go to deliver the food. And we are saying, as a Department of Social Development, working together with all the other departments such as the police, the military and all, we are going to help and coordinate, because the one thing we cannot afford is to leave our people without the necessary support. We also want to thank the NPOs, because as we speak here, the Department of Social Development has got a wide range of social services, which include shelters, for instance, which includes drug rehabilitation centers, which includes quite a number of those centers. And those centers, some of them have had to close down, but some of them cannot be closed down, such as the elderly centers and the orphanages. Those cannot close down, and therefore our responsibility is to make sure that we step up in supporting them and making sure that they are not left isolated. One of the issues that was raised to us this morning was the possibility of some of these centers, maybe especially of the elderly, being left without full support. And as a department, we have to step up working together with other departments. But again, we want to make the emphasis. We are at national level. We have to give the directives, but when all is said and done, the people that have to make sure that implementation happens are the provincial structures as well as the local structures. All the social services that we provide to the vulnerable in particular, that cannot stop. Now, here is one of the areas which I know that most people outside are interested in. We just came back from the meeting of the traditional leaders. It's with regard to the SASSA grant payments. SASSA is ready for social grant payments as from the 30th March 2020. The retailers and the banking industry is working very close with SASSA to ensure that everyone is able to access their grants. We did, from the onset, realize that this might be a problem, and to that extent, we worked with Treasury to make sure that the monies are paid a bit early so that people can be able to access that money. And we are very happy that Treasury stepped up and made sure that everything is processed properly. Citizens are reminded that older persons and persons with disability should be allowed to access their grants on the 30th and the 31st so that they can be able to return home as quickly as possible given the emergency that has been declared. All other grants will be available from the 1st of April. We are asking that the recipients don't rush to get their money as soon as it is available, but wait on their money so that we are asking them to wait as their money won't be taken away from them. Hygiene protocols and social distancing will be enforced at all retailers. Cooperation from everyone is requested to ensure that everyone is attended to without any necessary delays. We did already write a letter as a Department of Social Development to the Minister of Police as well as Defense to request that where we might need the support, they should be able to make sure that we keep the law and order, we keep the distance, we just adhere to all the protocols that have been declared. SASSA offices will be closed and will not make new applications. All applicants who will need immediate assistance will be channeled to SRD. Applicants for SRD will be done through the call center and the number will be provided. A notice will be placed in a prominent position at the entrance to the local offices, indicating that only a limited number of clients will be granted access to any one time. Preference will be given to older persons, mothers with very young babies, and persons with disability. The public will be informed that they should not report to local offices for issues such as simple enquiries which can best be handled telephonically or by mail. Additional staff and resources will be assigned to ensure that these queries are dealt with promptly to limit the need for people to come into the offices. With regards to the grant administration services, SASSA local offices will be on lockdown as from Friday, 27 March until 16 April 2020, as directed by the President. No new applications for grants will be done during this period of lockdown. Concerns and inquiries can be directed to the call center on 0800 601011 and email grant.e, and grant is E as in G capital, and inquiries E capital. So it's grantinquiries@sasa.gov.za or social media. The call center will be operating during this time of emergency, although the number of staff available will be limited, which might affect the response at this time. And I do want to indicate that we said, as the Department of Social Development, priority also goes to the staff members, and therefore the protection and the equipment and services that are needed by them, it's our responsibility to make sure that they are also protected. We also ensure that local offices limit the number of citizens on their premises. Consequently, this will reduce instances of face-to-face delivery of services. Likewise, the size of the waiting area and availability of adequate ventilation will take into account. This will be accompanied by strategically and prominently placed precautionary notices at entrances and service points of local offices. Additional personnel will be sourced towards these. The non-profit organizations, NPOs, who we rely to many at times, partners have been advised to activate emergency and response plans in 10 of the 18 members of the National Coalition for Social Services. Relevant messages are similarly communicated to beneficiaries and staff. Additional social service professionals, and this is very important for us, and volunteers are in the process of being appointed by NPOs in order to extend our services into communities. The NPO sector's commitment in our fight against COVID-19 has been publicized. I've also written to the Minister of Labor to include social professions, which include social workers, auxiliary workers, child and youth care workers, and community development officers into the compensation list of essential services. Shelters, all shelters will remain functional, and we will ensure that food is provided to old age homes, shelters, child and youth care centers, rehabilitation centers. However, no visitations will be allowed in line with the regulations. 235 community nutrition distribution centers and food banks will be operational in areas specifically rural through the provincial centers. Food will be delivered to beneficiaries' homes to limit movement of citizens, and those delivering will have to have protective gear and adhere. Community workers will receive accreditation. Community workers will have protective gear. This we are also raising because, as I said earlier on, we received from some of the NPOs that they have food that needs to be delivered and they're worried about their trucks on the way and all that, and I think that will work very closely with that. Importantly, the South African Council for Social Service Professions has galvanized social service practitioners into action for this to be the service of the nation during the disaster. The Council is also working with NPO sector in all 9 provinces towards the implementation of contained measures. We are also rolling out trauma counseling and training for our social professions. We do want to say that we are aware of the challenges that are faced by some of the communities, so that we need to ensure that there's no stigmatization. People that have already been treated and are well, we should be able to work towards ensuring that they return to their communities. The department is in discussion with disaster management team at COGTA for them to consider issuing specific regulations that will suspend the requirements of Social Assistance Act number 13 of 2004 that require face-to-face contact as non-essential. This will enable the department and SASSA to instead administer electronic applications. The fund will be used for social relief of distress. This includes provision of food in the main. What we would like to say is that in order to ensure that we have a coordinated approach, we are going to be talking about a center where if people have got issues, they must be able to send those requests, but we also really truly ask that people at provincial and local level start first with the provisions that are being done by the structures of social development at provincial level, so that we don't end up clogging the national structure when we actually have provinces that we are very well coordinating with. I thank you very much.
Thank you, Minister Zulu. Again, if we can just repeat why we're here. We are here to respond to the coronavirus pandemic that has beset not only our country, but many countries. As we all know, the President spoke yesterday on the country's response to the coronavirus pandemic here in South Africa. Ministers are now saying, what is it that we are going to do in ensuring that we implement the measures that the President spoke to the nation about yesterday. The next minister who's going to speak to the implementation plans is Minister Sisulu, our Minister of Water and Sanitation. Minister, the platform is yours.
Thank you, Minister Mthembu, and good afternoon to the media and the people listening at home. The day after the President announced that we are in a state of disaster on the 20th, we started making preparations for the eventuality. We established a common center together with MISA, which represents our provincial and municipality structures, and we are stationed currently in a command center in Rand Water, and that's where we're doing our communication and making sure that we are able to respond to people as they experience a problem. We have put in place all of these things because we realized that we needed to act very quickly in this particular situation. So when the President announced yesterday a complete shutdown, we had already established our infrastructure, and we are able to continue our work and ensure that we are able to provide our people with all the necessities that they require. We're facing one of the most difficult challenges of our time. We have a big problem to immediately solve, but as history has taught us, with every challenge that humanity faces, we find a solution that leapfrogs us into the future. And here we are in this particular situation, and we are determined to make sure that we are providing our people with decent sanitation, safe water, and we will have a strong injection of the latest science and technological solutions that we have available to us. We have had in the past groundbreaking innovations from this country, and we intend to use them and further deepen our understanding of how we can move forward. The Ministry of Human Settlements and the Department of Water Affairs, and the Department of Science, COPTA, have been working together, and we've been able to identify those vulnerable municipalities and provinces, and we will go into the details as we do a question and answer session here. With regards to the water and sanitation intervention, our focus is on water services and our infrastructure. As you all know, our infrastructure has been struggling, and we intend to use this opportunity to upgrade our infrastructure. But our first point of solving the problem that we have has been wash your hands. And the refrain we have heard from most people is well and good to say wash your hands, but what happens to us, those of us who do not have water? So we have taken extraordinary effort to go out and seek the necessary support from the private sector and ourselves. And we have so far identified 2,000 communities and additionally 2,901 sites where we are going to be able to provide water facilities, especially for those areas that have just come out of a drought and those areas that are in the rural areas. What we intend to do with water is make sure that we supply every community that needs water with the necessary tankers and the necessary tanks, and we will be providing tanks, and we will have collection points for water so that we do not have overcrowding around these areas. We will be in the towns providing hand washing facilities in public areas, concentrating in the areas where we have high density around taxi ranks, around bus ranks, around transport areas, and etc. Here we intend to ensure that we put a tank for every area and a wash basin so that everybody has access to this. In the rural areas, we will be providing, especially the elderly, with buckets that they will have in their home, together with the necessary sanitation, which will be provided by the private sector to make sure that they are able to wash their hands on a regular basis. We will be going into detail on this when we have the question and answer. We have already commissioned a number of tankers to go to most of the areas that are in need of water. So we are riding on the back of the drought and what we did in order to provide our people with water in the drought area. In the area of Limpopo, in the area of Free State, in the area of the Eastern Cape, we had already ordered some tankers and some tanks. So we are increasing the number so that we are able very quickly to cover those areas. We have commissioned our water boards to be the front line of our delivery, and we have water boards in every area. We're working together with our municipalities, and the municipalities have pointed out to us those areas very much in need of water, and we are responding to that. In relation to water, we would like to indicate that we are extremely grateful for the support that we have received from the private sector. And in this regard, I'd like to mention in particular the water associations that we, particularly Lebalelo. We would like to commend the mining communities in Limpopo especially. We would like to express our gratitude to Unilever and ShopRite and Checkers, which have made available sanitation facilities such as soap and liquid to help us make sure that we are able to provide the necessary sanitation. In our human settlements, I listened to the minister this morning because we were briefing our traditional leaders, and he was indicating how we are able to monitor the spread of the virus. And he was indicating his concern that while it was concentrated in those people who were coming into the country, it was able to trace those people. We were able to trace the people who've been in contact with an affected person. The biggest challenge will be when this virus gets into our densely populated areas, and these are the informal settlements. How are we going to be able to trace this, and how are we going to be able to avoid the quick spread of the virus? So our human settlements are a big problem for us. We have, with the help of the CSIR, used a heat map to identify the areas where we have serious congestion, and we have identified 29 areas of priority in our informal settlements. These are areas where we would need to go in and try and see if it is not possible to de-densify, but also make sure that we provide all the necessary sanitation to them at their doorstep. We will be in touch with the various provinces where we have identified these dense areas of informal settlements, and they're largely found in Gauteng, KwaZulu-Natal, the Western Cape, and the Eastern Cape. We would like to appeal to the people who live in these densely populated areas to allow us to work with them to try and de-densify these areas. In future, we will be able to get into the details of how we're going to do that. Ladies and gentlemen, we've established at Rand Water a facility where we will be able to respond to those areas which have serious water shortages. And I'd like to give you the toll-free number of the center, that anybody who is finding themselves in a situation where they might need to be directed to where there is water, or where we might need to direct a municipality to that person, here is a toll-free number from which we receive complaints, from which we receive concerns from our people. It's 08, it's not the one that's ringing now. It's 08 00 200 200. 08 00 200 200. For those who are listening at home, please write this down so that should you come across a problem of shortage of water, call this number. All our entities are linked to this number at the command center at Rand Water, and we will be able to get in touch with the nearest municipality to come to your support and assist you. As we anticipate that it is possible for this virus to spread, we will be working very closely with the Minister of Social Development, and we will be providing additional shelter for those people who need shelter. The President did indicate yesterday that we are an essential service, so we will be open right through this particular period. We will ensure that all of those people who are working are properly supported with the necessary gear that will protect them. We will be amongst our people, making sure that we can respond to them. The President further indicated those people who are homeless will find shelter that we will provide, and the Minister of Social Development will provide the necessary support to that. I think that we are close to the end. We could go on the whole day. Water and sanitation has been our biggest problem, and we've been dealing with it. We think that we are on top of the situation, and we've used our water boards, and we're very grateful for the support that we're getting. We will be getting to our people. We hope that we will get support from them in ensuring that we can provide them with the necessary hygienic support and stop the spread of the virus, because they will ultimately prove the most vulnerable they are. Thank you.
Thank you, Minister Sisulu. We'll now take the last presentation that will come from the Minister of Higher Education, Dr. Blade Simande.
Thank you very much, Minister Mthembu and my colleagues. Once more, apologies. We're just trying to tighten the loose ends before this press conference. So sorry for being a bit late. On the side of higher education, science and innovation, I want to say that I've just approved before this meeting a task team on post-school education and training, which is going to be led by our Deputy Minister, Bhuti Manamela, representative of all the stakeholders in the sector, which would be students, vice-chancellors, TVET college principals, trade unions, and other stakeholders who are part of our sector. And just to remind ourselves, the post-school education and training sector, its formal component is made up of about 2.5 million students. Very briefly, if I can start about the situation on TVET colleges. TVET colleges have closed as we agreed last week, went for an early recess on the 18th of March. And we agreed at that time that we were expecting, hopefully, to open on the 15th of April. But clearly, we will have, through this task team, to readjust that date in the light of the President's announcement yesterday. And we've made the necessary arrangements with the TVET colleges on rescheduling their exams, as they normally write 3 exams per year in particular subjects. The other matter that I would like to brief the media and our country about is the students that are returning from China. You will recall that there were students, 76 of them, who were at the range, who were evacuated from the Wuhan city. And as it has been announced by the Minister of Health, they've all been tested and found to be negative. And they are doing their final test this weekend. Also on Friday, the 20th of March, 80 other students have arrived from China, and they were on various TVET college programs, especially work placements in China. And they've all been placed in quarantine somewhere in Ekurhuleni, and they've been tested and we are waiting their results. And we've deployed 3 officials from the Department of Higher Education and Training to be able to ensure that all the processes that needs to be gone through are indeed done. When we announced that TVET colleges and universities were going on recess, early recess on the 18th, one of the things we agreed upon was the use of online learning during this period to support students whilst they are at home, as well as to ensure that we don't actually remain very far behind in terms of the students' studies. As a department, we are engaging the TVET colleges in particular, because that is where we have the bigger challenges about online modalities and which colleges needs what kind of assistance. Insofar as community education and training colleges responsible for adult education, as it was known in the past, we have had no incidents reported, but also they themselves took recess. On universities, universities have reported to us that they are actually implementing the following measures. As I've said, all the institutions have gone on early recess and gave students until Friday last week to vacate residences. And on this score, we would like to urge all stakeholders, as we did when we engaged them, that in whatever we do, we are all guided by science, and also we are guided by the direction as provided by the President. Such that if we say students must vacate residences, we are not saying that because we are unaware of the challenges that are to be there, but it is as a result of what we think needs to be done as the best way of doing it. And I've urged all the stakeholders to really engage, rather than to be in the unfortunate situation we were last week, where some students took Wits University to court that they don't want to vacate residences. International students, though, are being treated on a case-by-case basis, as well as all those students who genuinely cannot return home are being accommodated in residences. NSFAS allowances, I would like to say, for both TVET colleges and universities are being paid to the students. They are not being suspended just because the lectures are suspended and students have gone on recess. And also in universities, there are preparations as well as implementation of online methods. The universities have also put in place measures to ensure continuity insofar as research activities, but most academic staff are working from home and only essential service staff are on campuses, as well as minimal support staff where it is required. Some universities are assisting students with financial difficulties in order to get home. All universities will assess the situation at the end of the month and make decisions on what further preparations are needed. I would like to say that on the skills front, we have given instruction to our SETAs as well as to the National Skills Fund that in all the training initiatives that are funded, we need to ensure that we actually observe the directives as given by the President. Firstly, we did that with the earlier directives of not more than 100 people should be together, and now with the lockdown, we also expect them to actually respect that. We have an organization called Higher Health, which is working with and is an initiative of the universities initially, but now it involves TVET colleges who are actually following developments very closely on COVID-19, as well as assisting institutions, including clinics and other health facilities in our universities and colleges, to make sure that they are able to respond to the challenge better. And Higher Health is working with the college principals as well as with the university vice chancellors. These are the main issues insofar as higher education and training is concerned. Briefly, Chair, on science and innovation, I would like to report that the following progress has been made to support COVID-19 interventions. The first one is that it has become very urgent to locally manufacture reagents for testing kits. These are currently being imported, and the lockdown may threaten access to supply. So our Department of Science and Innovation has negotiated the repurposing of various facilities and laboratories to respond to the outbreak, as well as to assist in identifying a supply of the necessary testing kits that are needed. The entities that we have lined up to assist include the company BioVac, which the state has got ownership in, which is the main company that is producing vaccines for us based on research that is funded by our department. Also, there is Centers of Excellence in TB research, as well as Afrigen Bio. And discussions are on to facilitate accreditation of some of the facilities to produce these reagents so that we do not run out of them in order to be able to have effective testing kits. This afternoon, the team will be discussing concretely the budgetary requirements moving forward. The other scientific intervention that we are making is therapeutic trials on repurposing of drugs. In simple language, as other countries are doing, like China, Cuba, certain drugs that have been able to treat successfully particular conditions are being used to be tested in trials if also they are able to treat COVID-19. That's a very important part of science and research, because we may find that some of the drugs are also being used successfully in treating coronavirus. That is our contribution. Preliminary work also, I must say, is being done on the development of vaccines. And this has started with the University of Cape Town, the Center for Scientific and Industrial Research, as well as BioVac. Another important intervention that we are making is that we've started to build capacity for modeling. Modeling is very important in dealing with pandemics because it's actually monitoring the way the pandemic is evolving, including, by the way, the effect of the coronavirus in this instance on people who are more vulnerable. For instance, we in South Africa are also carrying a heavy burden of disease and HIV and TB. So it is important to particularly monitor those who actually have these conditions in relation to coronavirus so that we can be able to better respond to that. Another very important thing is data collection. We are working very closely with the Department of Science and Innovation, with the Department of Health, together with our other scientific institutions to make sure that we share data so that when we make projections and actually monitoring, including modeling, we are able to have the same database as everybody else. Now, on the basis of what I've just said, I want to conclude by highlighting briefly further work, therefore, that has arisen out of this. We have agreed that there is a very important need to have a centralized mechanism to look at the progression of the virus. And we will actually be using a machine that is in the hands, a system that is in the hands of the CSIR, the Center for Scientific and Industrial Research, which we have used successfully before, by the way, even during World Cup 2010, to then customize that system to enable us even to go to an extent of mapping where people who are suffering from the virus are. We can even go even street by street in any part of the country. That's the capacity that the CSIR has, which will enable, for instance, for the president sitting in his office to be able to just check any part of the country and see what is happening in terms of progress, where we are succeeding in treatment, and so on. That is one of the major contributions that my Department of Science and Innovation, working with the CSIR, which is one of its agencies, is doing. Another important area where we are doing work, and the President has rightly urged us to be quick on this, is the work we are doing with which we have asked the Human Sciences Research Council, the HSRC, to do, to actually study closely perceptions of our communities, of South Africans about this virus, the attitude that they have towards it, because that is very important if we are to succeed in dealing with the virus, to understand how our people are reacting to this and what they think of it, even actually to identify false stories that may be prevalent, so that we are able to intervene as when is required. So we are not only doing this with our science institutes, we are also involving the private sector as well as non-governmental organizations that are working on this. That is how far I would like to go, Mvelase, in terms of the contribution of my ministry as per the line of march provided by the President. Thank you.
Thank you, Minister Nzimande. Before we allow questions, let's give an opportunity to Minister Sisulu to say a few things that were omitted in the first contribution.
Thanks, Minister Mthembu. I did acknowledge and thank those members of the private sector that have come on board to assist us, but I omitted two, and I thought that it would be very unfortunate if we left them out. Our sincerest gratitude also goes to BUSA, Business Unity South Africa, and Santaco, who have committed to assist us, especially around the taxi ranks. Thank you.
We'll now get to the question session. I see there are colleagues that are ready to roll. Let's take 5 at a time. 1, 2, gone, 3, 4, 5. We have 5. Thank you. Let's start with number 1.
All right, thank you so much. Tidi Madia from News 24. For Minister Susulu, you're speaking now about these areas that you want to de-densify. Have there been conversations between your department and possibly land? Because I think part of the challenge will be identifying land to move people to, with regards to that issue. There's also a question around the areas that, I think, just give me 2 seconds, sorry. There was a question around areas that are not just water scarce, but the 29 areas, I think it speaks to the same issue as well. No, the municipalities rather, that you've been working with COC that you identified that are in distress. Where are they? What's the most worrying of the lot? Which province is it in? And how soon are plans to try and deal with those particular municipalities? Thank you.
Thank you very much. Next.
Hi there, Alex from News 24. I think you'll probably refer me to the security cluster briefing tomorrow, but just in case you won't, there are a lot of members of the public have been asking questions in terms of what their movements will be like during the lockdown. Will they be able to walk dogs? Will they be able to go running? Will restaurants be open? Will people be allowed to walk around in their complexes or in their suburbs?
But you know who will answer that question?
Security cluster.
You know that.
All right, yeah, but I'm just, hey, listen, people want it as quick as possible. Security cluster is only tomorrow. So if any of the ministers can help, then it's welcomed.
I was just trying to assist you because you know exactly who's going to answer that question. Next.
Good afternoon, Christian Duplessis from Netwerk 24. Minister Nzimande, with regards to trials for vaccines, can you just explain that process, how long it will take, and as well with regard to the manufacturing of testing kits, how soon can operations for that be up? Because we need a large number, masses of test kits being rolled out.
Yes, ma'am.
Minister Zulu, my name is Itekane from Newsroom Africa. For SASSA beneficiaries who use public transport, is there going to be any contingency plan to mitigate the transfer of the virus in taxi ranks and such? Thank you.
Snetemba Madola, Jacaranda FM. Minister Zulu, you earlier spoke of centers regarding elders and that situations. Is there anything with regards to domestic violence centers that may be threatening to shut down? There's sort of an expected spike regarding the national shutdown where abuse will rise. Are there plans in place to ensure that women, children in those sort of areas can be removed and centers are set up for them? And Minister Sisulu, do we maybe have a timeline for when the water and public sanitations will be then delivered to the disadvantaged areas and the like? Thank you.
You can answer from where you are, colleagues. Yeah. We don't know who wants to go first. Who wants to go first? Yeah.
I can go first. I think with regard to the issues of domestic violence, one of the things that we have already spoken to relates to, one, the fact that we have a shutdown and the fact that we have coronavirus, unfortunately for us, does not stop the challenges that are faced by women and children in their homes. It is to that regard that even amongst the ministers that are responsible, whether it's justice or whether the police, we are highlighting the fact that the lockdown must not ignore or forget about the challenges that we face in terms of violence against women and children. Also to that effect, in our meeting this morning as the department and as a portfolio, we highlighted this issue in terms of saying what exactly must people be expected to do when they are confronted by this issue of violence against women and children. And therefore, our call center will really have to be, will have to step up. And we are also saying to all, let's not lose sight. What will make it even worse is the fact that Many of the people who under normal circumstances, you'll find that for hours, they spend the hours at work or they spend the hours. Now they are going to be confined to their homes. And therefore the pressure that will then arise when they are unable to move will actually escalate. And so we're saying the psychosocial support that we need to have, we must strengthen that, we must upscale that. We are also saying to the provinces, please do not forget this as one of the priority areas for us, because we need to make sure that people have got access. Lastly, we are saying the deployment of the social services, and in particular, those that are supposed to go to their homes, is going to be very difficult, but it's a must. We cannot afford this hole when all is done. We cannot afford to find that many women and children did not have anywhere to go and report about that. As we are saying, it's work in progress. As we sit here, we're having this press conference. The task team of the department, together with SASSA and NDA, are sitting and connecting to the provinces and saying, how can we sharpen the response? How can we make sure that people have the necessary information? So our communication is also working around the clock to make sure that everything is communicated properly. We will also be available to communicate, especially the numbers that have to be called, but we also request our citizens to really make use of provincial and local structures that are available for that. Thank you.
Thank you, Minister. Minister Sisulu.
Thank you. In response to the question around land, are we in consultation with the Minister of Land? Yes, we are. We are in consultation with Minister of Land. We are in consultation with Minister of Public Works. And this crisis comes at a time when we have been in consultation over a long period of time. So we just have to increase the pace at which we are releasing land to us. And I am certain that we will get maximum support from them as we have in the past. Thank you. The second question was, we have 29 municipalities that we have identified. Where are these? And I think the next follow-up question was, how soon would we be providing water to them? These municipalities are largely in the water-scarce areas of our country and areas that have already experienced a drought, and that is the provinces of Limpopo, Eastern Cape, Free State, and Northern Cape. We're still receiving information around water shortages. We will be working at this on a 24-hour basis and dealing with information as it comes and providing support as information comes in. How long will it take us to provide water? We've already started providing water. For instance, already in the Eastern Cape, we have provided 47 tankers which have been procured and provided them to our priority communities there, where we've identified water shortages. And we've also provided more than 1,000 water tanks to the Eastern Cape in those areas most hit by the drought. We have concluded our procurement processes, and we expect that within a week it will be possible for us to provide all the communities that are in dire distress with water tanks rather. But this will be an ongoing process because as you know, a disaster of this nature is very difficult to predict with any certainty what it is that will happen, where we will experience more shortages. We're working on the information we have right now. There was another question that was asked there that I haven't answered, but the Minister will remind me and I will come back. There was another question. Thank you.
Now, colleagues, where we have not answered, you can say that, oh, this one you have not answered, we will answer it. Minister
Could you allow me to indicate this? We would like to say to all South Africans, we will do our best, we're doing our best, we're working on a 24-hour basis to provide you with the service that is necessary for you. Our first port of call is to wash your hands. We promise that we will be there to the extent that we can to provide you with that water. However, to all South Africans, please remember we are a water-scarce country. Please save water. Do your bit by making sure that you save water so that it can go a much longer way. Thank you.
Mr. Nzimande.
Thank you, Chair. Well, on the question of the vaccine, I just must point out that trials for vaccines, usually take 12 to 18 months. Unfortunately, it's not a short time. At the moment, we are working with other partners to harness knowledge that is available on this score. For example, the drug interferon alpha 2B, which has been produced by the Cubans, and they are also now using it in China to investigate if it is able to stop at least the replication of the virus. But I must just say this, that very clearly, as of now, there is no vaccine that is able to prevent. Mhlambe mvela sekuhle lokusibe sikusho nangolimi lwakithi ukuze nabantu bakithi bezwe kahle ukuthi ikhambi bangitolikela ke abanye ozakwethu la bazileze ezinye izilimi. Ikhambi lokwelapha lesifo lomkhuhlane osivelele alikakabi khona. Ingakho kubalekile ukuthi silandele konke okusho umongameli kunjengoba kunjalo nokuthi sigeze izandla sizivikele. Noma ikhona ke imizamo uhulumeni ayenzayo ebambisene namanye amazwe ukuphenya ukuthi singenza njani ukuthi sigcine silitholile ikhambi lalo mhlola esibhekene nawo. Insofar as manufacturing of the reagents is concerned, once we are able to establish how long the supplies will run out that we currently have, we can be able to work with the various partners to start in a matter of weeks. At the moment, as I have said, we are establishing, what is the projection in terms of the reagents that we have so that we do not run out of testing kits. But once we know that, with the partners we are working with, we could start within weeks at the most, after a few months. Thank you.
Let's come again, Minister Zulu.
Lina ke nagana hore hona le potso e ke sa e arabang kunombuzo engawuphendulanga we ndaba ye transport. I think leyo ibuzwe in newsroom. What we are doing, working together with transport, because sicela ukusho ukuthi we must not be isolated from the overall plan of government. We are as a plan isisodwa ukuthi thina siyisasa, this is what we're going to do. We are working together, and especially because ikhona le command center esibelonga kuyo esipota kuyo sonke. Indaba ye transport is of major concern to us. Kodwa ke we've also got ama suggestions esifuna ukwenza okufuneka siwayise kwi center to say sicabanga ukuthi abantu abama SASSA beneficiaries kuzofuneka ukuthi bakwazi ukuphatha amakhadi wabo bawabonise lamakhadi wabo so that bakwazi ukwase babonwe ukuthi baya lapho bayofuna khona ukudla, baya lapho bayodonsa khona imali. Sifuna ukusho ke kubo ukuthi bangajaheli bangagijimela ukuyodonsa imali ngoba esikhathini esiningi bayakwazi ukusebenzisa lawo makhadi wabo even for ukuthenga. So indaba ye transport sisazoyisebenza kahle because yona it is going to be an issue and we must have a concrete plan. Abantu bakithi nje balindele ukuthi sibatshene exactly what to do. Ngiyabonga.
Minister Sisulu.
Uminister Nzimande ungicele ukuthi ngimtolikele isiZulu. Ngimtolikele. Baba sabu isiZulu. Minister Nzimande are ha hona moriana tla re thusang ka se re tlhagetseng. Ke gona re le kopa hore le tlhape matsogo le sebise sepa le se show hore ha le sune batho le ba dumedise fela ka hore hi there hobane ka nnete ha re so kry moriana o re thusa ka nthena. Thank you.
Well, I'll also interpret. There is no cure for this coronavirus and the illness that we are all faced with. All we need to do is to follow the instructions and advice that we have been given by experts, by the way, in the World Health Organization and experts in our own Department of Health, led by our Minister of Health, and indeed, the message that has been given to us by our own leader, the President, and those messages are, let's wash our hands regularly with soap. Secondly, let's avoid crowds. We call that social distancing. In fact, the President said yesterday, let's stay at home. Sihlale emakhaya nje. Iyo indlela yokuvikela lo mhlolo esibhekene nawo. Colleagues, are there any others who like that? Though that will be the last round now of questions. Sese, Poti, we are repeating. I want those that are not repeating. Okay, you have a chance.
Rorisang Khosana from the Citizen. Minister Zulu, my question is related to the homeless people. Could you please elaborate on the plans for the homeless people? I understand they will be housed in shelters, but how will this be rolled out? Have the shelters been identified? Are we sure that the homeless will be off the streets by Thursday night? Thank you.
The next.
Vuyamboko, ENC. Minister Sisulu, can you, one, elaborate on the Busa and Santako partnership as to what it is exactly that it entails? And then on the question of tanks and tankers, will they be available tomorrow, like in the next couple of days? In other words, how soon will they be available, especially for those areas, the drought-stricken areas that you mentioned? Minister Nzimande, the repurposing and the manufacturing of the things you mentioned, how soon will that happen? Are there any timelines? Because, I mean, time is of essence. And then, Minister Zulu, the letter you wrote to the Minister of Police, yes, you did mention the need to sort of give psychosocial support to women or victims of gender-based violence. But were there other considerations? In other words, what informed you writing that letter? Are there other fears that you have that we may not know about?
So,
Alex Mitchley again from News 24. My colleague from The Citizen already asked the bulk of my main question regarding the homeless communities, but if I could just ask two add-on questions to that. The first one is, who will be locating, if there are going to be additional shelters, will that be up to the municipalities to decide on those? And my second is, shelters are already quite often overburdened and are very small, stuffy spaces where it would be very difficult for people to also practice social distancing there. Have you guys come up with any ideas on how we can keep the homeless housed, but also keep them safe in terms of obviously curbing the spread? Thank you.
Colleagues, let's start with you, Valanzimand.
Thank you, Chairperson. What I should have said also, Vuyo, in my area is that the potential advantage of repurposing, in other words, like the US is doing now, they are testing malaria, or drugs against malaria on some of its trials, on some of the people with coronavirus. The advantage of doing that is that if it so happens that there is already a drug that is in existence that is actually able to deal with the virus that we have, it then shortens the period of the 12 to 18 months that I'm talking about of actually coming up with a vaccine. But it's difficult to tell because it also depends, that which drugs that have been repurposed, which one is responding better than the others, what are the mix and so on. Repurposing hopefully will shorten the 12 to 18 months period if we are able to find a drug amongst the existing one that seems to be dealing with this. But it's difficult to tell whether it's 6 months or 3 months. But all I know, repurposing, if we find something, it does tend to speed up. Unfortunately, that is how science works because we can't take a risk, with human beings. That's why the period is 12 to 18 months, because we have to test, wait for the results, retest, control this aspect if we are testing this and so on, so that we are sure that by the time the drug is licensed, that it is able to do what it is supposed to do, it indeed does. So that's the give and take that we have in terms of ensuring that science is able to respond as soon as possible, but without undue rush, which can cause more havoc. Thank you, Mvelas.
Minister Sisulu.
Vuyo Mvoko, I'll give you a breakdown as it is written here of what we have been provided for, and you ask specifically what it is that Busa and Santaco have committed to. They've committed to working with us, especially around the issue of taxi ranks and us providing washing facilities around taxi ranks. They will be able to identify which are the densest taxi ranks, and we will be working in collaboration with them. And anything else that we might develop out of this relationship will be just a plus, but we have a relationship with them that they have committed to assist us. Similarly with Busa, I think we will find in this document here what it is that they have committed to us. I think it would be better if you have sight of this than I go through this. We are also opening ourselves up for any support that we might get from anybody in the private sector or anywhere out there, because we have a dire situation to provide our people with all the necessities of water and human settlements requirements. The second one you asked is how many tanks have we provided, have we got? Basically, we are aiming to buy out all the tanks that are in the country. So we would like to send out a message to say to anybody who's producing or selling them, please stop. We would like to take all of them because we need them much more than any individual might need them because of their spread and the number of areas that we have to cover. Fortuitously, we had already started making the orders. This had been prompted by the drought, because when the drought came, we were unprepared for the situation. But right now, learning from what we have learned from the drought, it is possible for us to fast-track this. And as I indicated earlier on, we've already done the procurement process. We finished it, and we're hoping that next week we'll be able to provide tankers and tanks around the country, starting with the most needy, which is the elderly in the rural areas, and then closer home to the informal settlements.
Minister Zulu.
Thank you very much, Vuyo Mvoko. We were trying to be proactive about this issue of requesting for support from the Minister of Police as well as Defense, because we were thinking if the recipients of social grants end up being in places and in large crowds, we will then need proper crowd control, because we want to make sure that people adhere to guidelines and regulations. But also we're trying to be proactive so that the ministers might be able to direct us at provincial level, especially for SASSA. We wanted them to be able to send the information on time, just in case, so that they can work with us both at the level of SASSA, but also as well at the level of the post office, including where we are going to be having pay points. We want to make sure that even at the pay points that adhere to that. We issued the letter even before the final announcement was made by the president, because we didn't want to be caught up in the bureaucracy of saying how long does it take to do this and do that. The other issue relates to the homeless. Again, we believe as a department, and we have identified this as one of the issues that, like Human Settlements has said, they want to go beyond what we are facing now in terms of settling of people. We saw this as an opportunity to work together with local structures, because we are not necessarily responsible as a department in terms of finding the shelters on that part. We are responsible as a Department of Social Development, because you cannot say we are responsible for the well-being of citizens and ignore the fact that there are people who are homeless. We did put this for discussion in our task team, and I'm hoping that as this is work in progress, we will get plans. The call for us we made in as far as this issue is concerned was to say to the provinces and the local structures, please help us in the identification of where these people can be taken to, but also there's an issue of, do they want to be taken anywhere? And therefore the law must also take its course, because in some instances, some of them are in the outside and they go out asking for food, and we never know what might happen there. So we are taking this very seriously as an area, and therefore the shelters must be available to us. And because it's extraordinary circumstances that will need extraordinary action, some of the things might not necessarily be perfect. The places where we have to keep them might not necessarily be perfect, but we'll want to use this opportunity also to make sure that people are also assisted in appreciating and understanding. Remember that also some of the people who are homeless, they are not in a very good state of mind, and therefore social workers and other people who are supposed to help us in this will have to step up and appreciate the fact that they also just deserve the assistance that we are giving to all citizens, irrespective of the fact that they are out there and homeless. Other organizations and NPOs have also stepped up to say, Minister, we are here, we are available, what must we do? I've been getting lots of SMSs, we've been getting lots of emails from citizens who are running NPOs who are saying, just connect to us, we want to be part and parcel of finding a solution. And that's why earlier on, I wanted to say we thank them for stepping up. We need each other at this point.
Colleagues,
Can I just quickly repeat the numbers, because the issue of violence against women and children is really a priority for us. The GBV center number is 0800 428428. And Skype, for those who are able to access, Skype is Help Me GBV, all capital together, and then the number is *120 *7867#. That's a toll-free callback number. Thank you.
thank you, Sister. Colleagues, members of the media, again, and people of our country watching this broadcast, we appreciate that you have been listening to our ministers since 10 o'clock this morning up to now. Most appreciated. Our duty as government is to give as much information as possible under these circumstances. That's why we are giving all this information to our people so that they can protect themselves against the spread of this infectious disease, coronavirus. But we thank you for having listened to our ministers this morning, and thank the ministers as well for having come here to share what plans we have to deal with this virus, coronavirus in our country. We really appreciate, my colleagues, that you have come here. Members of the media, we appreciate that we have been able to use you as a conduit to connect with the people of our country. We now have the last briefing session for tomorrow. That's when we will have tomorrow at 10 o'clock at the GCIS auditorium. That's when we will have the ministers of police, ministers of justice, ministers of defense, ministers of transport, amongst others, who will speak to us tomorrow. We really appreciate that you are part of our war against the spread of this disease. Members of the media, you have made yourself available, you have made yourself a partner for all of us, with all of us, to fight the spread of this infectious disease. We will see you tomorrow then at 10 o'clock at GCIS auditorium. Thank you, and thank you very much. Don't forget,